There's a unique kind of frustration that comes from waking up in the middle of the night, your calf twisted in pain, and all you can do is clutch your leg and wait for it to pass. Muscle cramps. Whether they strike suddenly during sleep, after light exercise, or just from sitting in one position too long, are something many older adults know all too well. And while staying hydrated and stretching are foundational, some people still suffer frequent cramps that interfere with their daily life. In today's video, we'll go deeper into a topic that often stirs confusion: the role of medications and herbs in managing or preventing muscle cramps. Some options are available over the counter, others by prescription, and some have been used in traditional medicine for centuries. But not all solutions are equally safe, and some could be dangerous if used without proper medical guidance. Let's begin by talking about medications that are sometimes used to treat muscle cramps. One of the most commonly discussed is quinine sulfate. This used to be widely prescribed for nocturnal leg cramps, and in some countries it still is. However, over time, health authorities like the FDA in the U.S. issued strong warnings due to potential side effects, such as irregular heartbeat, low platelet count, and severe allergic reactions. While quinine may reduce cramp frequency for some, its risks mean it's typically only recommended in persistent severe cases under close medical supervision. Other medications that have been explored include muscle relaxants like cyclobenzaprine or antispasmodics. These drugs aim to calm overactive nerve signals or relax skeletal muscle. However, they often come with drowsiness, dizziness, or dependency concerns, especially in older adults who may already be on multiple medications. This is where things get tricky. You might be trading one discomfort, the cramp, for another, brain fog or falls. Some studies have looked into gabapentin or baclofen, particularly in people with neurological causes for cramps, such as spinal issues. Again, these are not standard treatments and should never be started without a doctor's evaluation. So what's available that's more gentle, or perhaps more natural? This is where herbal remedies and supplements enter the picture. Let's start with magnesium. It's not a herb, but it's often grouped into natural treatments. Magnesium plays a key role in muscle contraction and nerve signaling. In theory, a magnesium deficiency can contribute to cramping. Some people, especially older adults, may have marginal magnesium levels due to decreased absorption or medication use, like diuretics or proton pump inhibitors. Supplementing with magnesium citrate or glycinate may help, but only if a deficiency exists. Taking too much can lead to diarrhea or even kidney strain, so always start low and talk with your doctor. Moving into herbal territory, one of the most well-known remedies is mustard seed or even pickle juice, believed to stimulate a reflex in the mouth that helps inhibit cramp-related nerve signals. This works more through the nervous system than the muscle itself. Anecdotally, some people find it helpful, though scientific backing is limited. Chamomile, used in teas or oils, has anti-inflammatory and mild muscle relaxant properties. Some small studies have found that massaging the legs with chamomile oil can reduce cramp frequency, particularly in pregnant women or older adults. Another traditional remedy is valerian root, which has calming effects and may reduce muscle tension. However, it can cause drowsiness, interfere with medications, and should never be combined with sedatives. Turmeric, rich in curcumin, is known for its anti-inflammatory effects and may indirectly help with muscle soreness or chronic tightness. Adding turmeric to meals or taking it in supplement form, ideally with black pepper, could support muscle recovery. Don't forget ginger either. It improves circulation and reduces inflammation, which might make muscles less prone to cramping under stress. Ginger tea is a gentle, safe option for many. While these remedies can be appealing, it's essential to understand the potential risks of self-medicating. Some herbs interact with blood thinners, diabetes medications, or sedatives. Others can cause liver strain or allergic reactions if overused or combined with prescription drugs. That's why before trying any supplement or herbal extract regularly, even something as simple as magnesium, you need to consider your full health picture. Talk to a qualified healthcare provider, especially if you're already on medication for blood pressure, diabetes, or heart conditions. Interactions are a real concern. If your cramps are frequent and severe, you might also ask your doctor about getting tested for underlying issues. Electrolyte imbalances, nerve compression, circulation problems, or even vitamin D deficiency. Treating the root cause is often more effective than patching the symptoms. Let's wrap up with some practical tips. Keep a cramp diary to track when they happen, what you ate, your activity, and hydration. This helps identify patterns. Be skeptical of miracle cures or highly marketed supplements. Just because something is natural doesn't mean it's harmless. Don't mix multiple remedies without professional advice. Try lifestyle changes first. Hydration, stretching, warm baths, foot massage, and good sleep habits. With the right knowledge, many people can reduce or even eliminate the discomfort of muscle cramps without resorting to risky treatments. But it all starts with understanding your body, asking the right questions, and not falling for shortcuts. If you found this helpful, consider sharing it with someone who struggles with nighttime cramps or unexplained muscle pain. Education is the first step to prevention. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor before starting any new medication, supplement, or treatment plan.